We are at the 2023 World Health Summit to try to accomplish many priorities and deliver a different outcome for the people and communities we serve. This particular session is unique because it speaks to the aftermath of a pandemic we all bore witness to. We do not want to forget its impact. We want to implement its lessons learned now and be the generation that hurried towards the change that COVID-19 necessitated. We have a panel that is going to share some views, offer an assessment, and share some tangible directions in some specific areas with us. So let me invite our panelists to join me on stage at this time. Thank you very much. So I'd like to welcome each and every member of this distinguished panel. The session is Learning from COVID-19 for Future Pandemic Prevention, Preparedness, and Response. And the panel will discuss how to ensure equitable access to tests, treatments, and vaccines. I would like to first introduce His Excellency, Minister Karl Lauterbach, Federal Minister of Health for Germany. Honorable Minister, last night at the opening, you encouraged us to have a discussion at this summit to move these important priorities forward. So thank you for helping us do that today. We regret that our colleague Precious Matsoso was unable to join us. I know some of you are looking forward to her participation on the panel today. Next, I'd like to welcome Dr. Christian Dorsten, who is currently the director of the Berlin Institute of Virology and co-director of the Center for Global Health. Christian is world-renowned for co-discovering the SARS-CoV virus and for developing one of its first diagnostic tests in 2003. Welcome, Christian. Our rich panel continues, so let me welcome Jaya Oha, the CEO of Access to Medicine Foundation. She brings enormous experience from public-private partnerships, and we're looking forward to her contributions on the panel this morning. Welcome, Jaya. Next, I'd like to introduce Thomas Cuny, who leads the International Federation of Pharmaceutical Manufacturers and Associations and has represented Switzerland's research-based pharmaceutical industry in the past. Welcome, Thomas. Our last member to be introduced is Joy Fumafi, who has been both Botswana's Minister of Health and Principal Auditor, Vice President at the World Bank for Human Development, and is Executive Secretary of the Africa Leaders Malaria Alliance. She also brings a diversity of thought and experience to the panel. Welcome. So I'd also like to introduce myself. My name is Mamadi Yoa. I serve in the US government's State Department in the Bureau for Global Health Security and Diplomacy. It is a new bureau that was just recently launched by Secretary Blinken. It houses the PEPFAR program that I have served for the last 18 years, and also our efforts in ensuring that the aftermath of COVID is something that our government responds to very well. So we're going to try and have a discussion. Some of us know each other and others don't, but we're hoping that we have something to offer to this audience and the folks who are also joining us online as we discuss these issues. I'm going to first turn to the Minister to share his views and paint a picture of what will assure us collectively that we're better prepared for the next pandemic. So, Minister, over to you for some reflections.
Thank you so much for this opportunity. I try to be brief, but I also try to be as blunt as possible so that we have a shared understanding and have a good discussion, and we do not, let's say, speak too much in the often necessary but somewhat watered down language of diplomacy. COVID obviously did have a devastating impact on the world, and despite the fact that the pandemic is formally over, many people are still suffering from the pandemic. Most importantly, those people who survived but are suffering from long COVID. And long COVID is a disease which is still not really fully understood, but it is not a psychological illness, but it is an illness with many organic manifestations, cardiovascular manifestations, cognitive manifestations, increased risk for further disease along the line, also often leading into ME/CFS, so a number of diseases for which we currently do not have a good cure. And since more cases are occurring, we are currently at the brink of another winter wave. We also have to take into consideration that even after vaccination, if you get COVID infection, that there is still a likelihood of becoming ill enough to survive, but to develop a long COVID affliction. So therefore, I think the COVID pandemic teaches us that every pandemic is a long-lasting issue. It is not something that happens and then is over, but typically the virus which causes a pandemic is meant to survive and is meant to be with us. So in that sense, the world has become a less livable place, with SARS-CoV-2 be one of the, let's say, viruses around from which we can become sick at any given moment. This, in my opinion, makes it clear that it is so important to invest more into prevention of pandemics. And there is always a short window between an outbreak becoming an endemic, becoming an epidemic, becoming a pandemic. And we need to use that short time frame, which we much better now understand than we did in the past. And I still think that pandemic prevention is vastly underfunded. If you look at the economic consequences of the COVID pandemic and put this into relation in what we currently spend for pandemic prevention, then I would assume that we spend currently less than 1% of what the COVID pandemic has cost us by now in order to prevent future pandemics. So there is a huge miss as, let's say, initiatives, how we more quickly develop vaccines and so forth. We have a much better understanding to use the time spent, the short time spent between an outbreak and a pandemic, but we underinvest here. And I think that this is the biggest challenge ahead of us, for us as political leaders. It is only one example, but in order to, let's say, express numbers, I apologize, but I'm known to use too many numbers. So, but let me give you just one number. If we, for example, look what the pandemic fund would currently need in order to live up to its, let's say, full potential in training people for surveillance and training people for pandemic response, bringing that information together, we would need about 10 billion per year. But the pandemic fund currently is the best idea, into which we invested a lot of knowledge, into which we invested a lot of, let's say, political capital, but which is then dying because we do not have hard money for it to be continued. This is just one example. And what is most important that we now really think on what we should focus, because currently there is a competition of existing institutions or new institutions and institutions that are meant to be established. They all compete for the same money. So we may be spreading ourselves too thinly that we invest into too many initiatives at the same time and ultimately end up with many new initiatives and we are underprepared. This was exactly what happened when the COVID pandemic happened. If you look at all the institutions that were in charge of addressing new pandemics when they arise, and you look at all these acronyms, it is a completely impressive list. If you look at this list, you wonder how could the virus ever be successful with such a large list of institutions being responsible. But if you look at the institutions, all of them had 10 to 150 people working for them. So that type of a workforce by no means is a successful workforce in order to, let's say, approach these issues. So often we have formidable names, we have wonderful ideas, but all of these institutions are vastly underfunded. And what I think is needed is that we do have a good pandemic agreement, that we have a couple of institutions that are responsible without infringing on the executive rights of the countries involved, and that we make ourselves clear that these institutions will only work if they are regarded as owned by the countries in which they have to operate. We will not be able to bring in foreign forces when there is an outbreak. That has to be done from within these countries, and the support has to be asked for and not be offered, let's say, very aggressively. So if we do not, let's say, if we do not support the countries where pandemics are likely to arise, and these are roughly speaking about 40 countries or so. 40 countries are the, let's say, the source of most pandemics that are likely to arise. If we do not support these 40 countries with money and institutions that they govern themselves, then we will not be better prepared, but be maybe worse prepared, because we now have also the info and pandemic against us, where, let's say, everything that we do is basically questions by a social media war, which will make it way more difficult to organize a response towards a future pandemic. This is where we currently are, and I think a meeting like today's meeting is an important meeting to focus on what is meant to be the substance of the pandemic agreement and what core institutions are we going to support, both intellectually but also financially.
Thank you so much for those comments, and I know our panelists have come prepared for their own individual responses, but I'm hoping that you will also respond to some of the challenges that the Minister has put forward. So I'm going to turn to you, Christian, next for some views on that, and looking forward to what you have to say.
Yeah, thank you. So as I have 3 minutes, I'm picking out 3 issues, right, to speak about. And these are those on my horizon. So I'm a virologist working sometimes in a global health context. And of course I suffered through the pandemic like everybody in the field. But what really strikes me, and these are really my top priority items on the agenda for being better prepared for the next pandemic, is 3 things. One is in the, let's say, where the virus comes from, in the interface issues, the source of the virus. What tends to be ignored, or what tends to not get highest priority, is livestock. It is livestock. Every pandemic virus, every respiratory pandemic virus that we know historically came through livestock, and we are ignoring this fact. This is not in the documents. So there is a lot of One Health general terminology. There is a lot of concern about wildlife sources. And yes, ecologically, we know viruses come from some wildlife host, but the contact between this host and humankind is often or always via livestock once we're speaking about a respiratory pathogen. So this is true for influenza, this is true for most coronaviruses for which we know the natural history of disease, and you could enlarge the list. We have MERS knocking on the door in a major livestock species in the Middle East, the dromedary camel, and we have to admit that the use of fur animals is driving not only the emergence of SARS-2 but also of H5N1 influenza, as we see. So we have the live examples on the table, and we are ignoring this in the policy making. So we have to invest in livestock surveillance. And this probably is key to the problem. We are not speaking about livestock research, we are speaking about livestock surveillance. This is much more important, much more expensive also than some research program on wildlife. And often the research program on wildlife is a decoy from the actual investment that needs to be done and that needs to take the national states, the countries on board, which is livestock surveillance. Then the other thing is, as the virus now comes to humans, we need to detect it. And we are seeing the establishment of, let's say, continental-wide sequencing networks. This is a very meritful endeavor. However, we need this to be in the context of standard microbiologically competent laboratories. So the level of the hospital laboratory system and the public health laboratory system in most LMICs is really more than disappointing, right? So we need much more laboratory capacity building in the normal tiers of the lab, the standard microbiological, standard virological detection of standard diseases. So we need to be able to detect herpes viruses, measles, respiratory viruses in normal clinical practice and in normal public health surveillance. And this needs much more investment than to establish some sequencing excellence centers, which are nevertheless necessary. And then the other issue, as we are with the virus, is communication and disinformation. And this is such a complex issue. There are many media people here who exactly know what I'm speaking about. This is really the intervention in the beginning of a pandemic. So there are two interventions that are really efficient before we have a drug or vaccine. This is diagnostic testing, and then it's political decision making. And once this political decision making is influenced and contorted by disinformation and propaganda, we are lost. And there are roles that are not being fulfilled by the media themselves. They really have to look in the mirror. And there is another role that's sometimes ignored a little bit, which is the role of science itself. So we shouldn't have anybody who has some academic degree talking about the heart of the issue in the middle of a pandemic. We have to address the institutions of science to make some selection, to set up panels of experts who are really experts and who wouldn't push into the media, but who are somehow qualified to summarize the state of knowledge. And this can only happen via the institutions of science. These institutions have to offer this function to society. And these institutions of science, they are actually consisting of scientists, of top scientists, and it's really about being a little bit less opportunistic as a scientist, being a little bit more of service to society. That's my point.
Thank you. So we're going to continue the conversation, and the Minister actually mentioned this as well with regards to your views on the pandemic fund as one of the concrete constructs that has emerged after the COVID-19 pandemic. The World Bank describes the fund as a collaborative partnership. What, in your view, is its opportunity to help answer the question that was framed to this panel in the beginning? How do we grow the fund to reach its intended target? The Minister mentioned that it contains about 2 billion a year right now in commitments and requires about 10 billion. And what should these funds be invested in? And I'm going to start with you, Jaya, to share your views on the fund.
Sure. So I think the fund as a construct is the single most...
Yes, right.
It's one of the single most constructs that's really going to decide the fate of what's going to happen with the next pandemic itself. I want to start off with a number of points. First point is access is not a given thing. So at the end, when it comes to... You can't hear me? No. Should I bring it a lot closer like this? Would this work? Okay, I'll lean forward also. So I think the first point I wanted to make is access is not given, equity is not a given thing that occurs in every single country itself. When it comes to even chronic diseases or products that are brought into the market, less than 10% of people actually get access to this, even in high-income markets. And in low-income countries, it's less than 1% of people who get access to new products that are brought into the market itself. So the single most thing that I feel that the fund needs to prioritize is that equitable access of new commodities and existing commodities so that you're actually saving lives in low and middle income countries itself. The second thing I wanted to bring forward is over the last few years, we've seen that a majority of the largest industry partners, so a lot of the large research-based pharmaceutical companies, have actually left infectious disease research. More and more is actually put on the hands of smaller biotech companies to come up with the new innovations when there is a new pathogen in the world itself. And this is the case whether you're talking about drug-resistant infections or the next emerging infectious disease. In our research, and we've been researching the pharmaceutical industry for over 20 years now, we've actually seen that out of 16 pathogens that have been deemed as of epidemic or pandemic potential in the future, that's listed by the WHO itself, the research and development pipelines are mostly empty. So we neither have research and development and the agility to come up with research and development and new products at the speed at which we need it, and nor do we have the issue of when we do have a product on the market, it's not reaching patients that need it at the most. So at the end, the main purpose of the fund needs to be to bridge that equity gap so that people who are the most vulnerable get access at the same time as everyone else in the world itself. When you think about how to grow the fund, the fund, as I agree with the Minister, is grossly underfunded. So we do need to realize that with a limited number of resources, we're not going to make a lot of progress when it comes to improving the health systems that need to be improved and ready for the next pandemic. And we're not even going to be able to spread that in a thin way. So we definitely need more countries to recognize this as a global public investment. And invest in the fund itself. It needs to be a combination of public and eventually private entities that are investing in the fund and keeping the fund and the success of the fund also in place. An important aspect of that is some of the funds have been dispersed to different beneficiaries already, demonstrating how those beneficiaries are actually building a long-term health system, how those beneficiaries are actually creating a system that's going to prevent us from seeing the loss of lives and loss of economies due to the next pandemic. I think it's an important aspect of convincing others to keep investing in the fund itself. I think I'll stop here for now and then take on more points later.
I appreciate that perspective because I do think that for folks to actually continue to see the value of the pandemic fund, this first round of investments is going to play a significant role as to whether that's the one they choose. Right. Thomas, would love to hear your perspectives on the fund.
Now, basically, I can echo a lot what was said by Minister Leitzenbach, also Christian Drosten and Jay. When you look at the economic cost of COVID, it cost the world $13 trillion. $13,000 billion in economic loss, and way above 10 million lives lost. I think we, to some extent, need to change the narrative. Many people talk about health security. This is about economic security. And the same goes, by the way, when I look at the silent pandemic, the slowly melting glacier called AMR, which is also in terms of the cost versus what would be needed to stem it. Therefore, we fully support, the pandemic fund. We fully support the fifth, and we need to address that. And it's a shame how little money went into it right now. When I look at my experience from ACT-A and COVAX, it was clear countries are more willing to give money when they exactly know what's for. That's why vaccines were much more successful than therapeutics or diagnostics, but we really need to work on prevention. And I liked what you said on the prevention part. We need to strengthen healthcare systems. UHC 2030, you can't just expect the money will come from somewhere, manna from heaven. countries also need to rise to the occasion. And I always, when I look at the Abuja Declaration, how few countries have really lived up to the commitment in Abuja. Therefore, we need to call out also for domestic funding. And when we look at the problem, once we had enough vaccines, with the rollout, get the jabs from ports to arms, that's an issue. But I'd like to pick up also on a point which both Minister Lauterbach and Christian Drosten mentioned. We need to have a One Health approach. I was in Germany in 2017 when the G20 meetings took place. At that time, ministers of agriculture agreed to stop use of antibiotics for growth stimulation in industrial livestock. It lasted a year. And we still haven't. And when you look at the dangers in terms of livestock and animal health, I think one should talk about the dangers coming out of wet market. I haven't heard many people talking about, let's tackle these problems. That's why I think prevention is absolutely key. Preparedness requires investing in health systems, surveillance. We had earlier this morning a breakfast on pathogen sharing. And I think this is a societal task where you need to involve the private sector. In many countries, private sector, informal sectors are stronger than the public systems. Therefore, one needs to be non-dogmatic if we want to see results. But you need the money. COVAX, for example, initially was hampered. They couldn't sign procurement agreements before they had the money in the bank. And when they had the money in the bank, they were back in the queue. When Modi, shut the border, it took 6 months to overcome that. That's why we need to address the equity issue.
Thank you. Joy, it's your turn.
Same question?
Yes.
I think what is really important for us to appreciate, it has been said already by members of the panel, is that financing is needed for the systems, whether it is the One Health system, coming up with a platform that merges human and animal health. I come from a country which has started doing that. That is Botswana. But it needs a lot of resources. It's not something that is easy to do. Look at the research and development, the cost of that, the transfer of technology from wherever the innovation has taken place to where the manufacturing process is going to take place. We have talked about technology transfer, for example, to Africa. That is going to cost money. In order to develop easier access to medical countermeasures. We talk about the socio-economic preparedness. That is going to cost money. When we're talking about the communications and social media interventions that will be required in order to avoid the misinformation. The multi-sectoral preparedness, the education sector, our children needed to be educated at home. And for some of us who are coming from developing countries, we didn't have the access to the internet or the digital tools that will enable us to teach the children at home. So the human development, all of that needs a lot of resources. Now the challenge is that the fund as it currently exists is very, very limited. It only has less than 2 billion. I agree with people who are saying that our funding mechanisms globally are fragmented. But trying to combine them is going to be a huge headache. So my proposal would be that every existing fund should contribute to the pandemic fund. Because a pandemic, puts everything at a standstill. So it cripples everything. So first of all, it should not just be governments who are contributing to the fund. Every government should contribute, and this should be included in the treaty. It should be a requirement in the treaty. It should be every stakeholder, that means the private sector. There was an IFI mechanism that was developed for developing, mobilizing resources, floating bonds on international markets that were guaranteed by governments, front-loading development assistance. The same concept can be adopted by the private sector for its corporate social responsibility funds and by foundations. But in addition to that, every stakeholder should have a responsibility to contribute. And we can only achieve this through a binding global treaty that has got enforcement mechanisms. That's it.
So I think that's actually a fantastic segue into a discussion amongst this panel about the pandemic accord. And really we want to challenge you all, having had the IHRs have both successes and limitations. It was a binding agreement, it was backed by a treaty, but it wasn't sufficient for the pandemic we just came out of. So how are we going to assure a different outcome and an accord and an agreement amongst member states that we can indeed learn from this experience that we've had and actually come out the other side with something that will make a difference for the people we serve. So we're going to go to every member of the panel to hear your views, and I'm hoping that at the end of this panel that we have left the audience with something from each of your perspectives. So I'm going to start first with the Minister to speak to that.
Thank you. First of all, let me stress that it is a very, very important question whether we have a pandemic agreement by May or not. If we do not have a pandemic agreement, I fear that we lose the momentum of the pandemic, and it's an open question if we will ever have a pandemic agreement, which is a strict agreement, a working agreement, which provides more security than what we had when we entered the COVID pandemic, if we do not have it by May, because we have by now negotiating about it for a very long period of time, and the issues are on the table. And so now, to put it in the terms of Ludwig Wittgenstein, the famous philosopher, now is the time where the spade has to be turned. And if the spade is to be turned, we need to be open about what can move forward and what cannot be moved forward. I think that for, let's say, countries like Germany and most European countries, it is clear that such an agreement will not fly if there is a major, let's say, limitation on intellectual property rights. This is partially that is part of our DNA, basically, that we need intellectual property security in order to invest into vaccines, invest into therapeutics, diagnostics, and so forth. So while it is quite clear that we must have a much more equitable distribution of the benefits of such inventions, and that countermeasures, for example, need to be more equitably distributed, and it is also quite clear that we were not working to the satisfaction of even our own standards when we distributed the vaccines. It is clear that an agreement which, let's say, limits intellectual property rights is very unlikely to be successful. This is at least my impression. Number two, I also think that such an agreement is not likely to be successful if there is even the impression that executive power moves from the countries into the agreement or WHO. So therefore it must be quite clear that all the countries that sign up to the pandemic agreement, when there is a pandemic, that their full executive power is by no means curtailed, is infringed upon. So this is an agreement on standards, on norms of, let's say, responsibilities, but executive power is always within the countries that are the countries where the action takes place. And number three, it's also important that we take money into our hands in order to really provide poorer countries with the countermeasures, with, let's say, the benefits, with access to vaccines, also production facilities, that we come out of a situation where in poorer countries, for example in Africa, 90% of the vaccines that are currently used there and 90% of the drugs that are currently used there are imported and are not produced in Africa. So therefore in poorer countries we do have the capability of production and also have the capability of doing independent research. So I think a pandemic agreement needs to be a fair agreement where we make sure that production in the future is also done in the countries that are poorer countries, because in any case of pandemics there will be supply chain problems, and these supply chain problems are always the most difficult problems for those countries that cannot produce for themselves. So I think that these are, let's say, three major areas where I think we have to consider a pandemic agreement to move forward. There's many others. All things considered, I'm confident that we will ultimately have a pandemic agreement. I also think that, let's say, WHO is doing a fantastic job to make it come about, but we have to be very open and blunt about where our limits are and where we can move together. And we need such an agreement, because if we don't have an agreement, the next pandemic is certain to come. And without such an agreement, we would be possibly in a worse situation than we were when COVID hit us, because as Professor Christian Dawson pointed out, the misinformation pandemic, which is now widespread and is an ongoing pandemic. I mean, this is the misinformation pandemic is a pandemic which is simply always with us, as a matter of fact. So we are, in that sense, even in a more difficult position than we were before the pandemic. So a pandemic agreement is a necessary step for us to move forward and make sure that we are better prepared, and in particular those countries are better protected that are least capable of protecting themselves without a fair agreement which we owe to each other.
Honourable Minister. Thank you for so well articulating those positions. I think this is probably one of the most significant conversations of the day about our current world order, the experience that countries had in this last pandemic, and what happens differently. And so I'm very pleased that the panel is going to offer its views for those who are politicians or those who are not politicians, because I think the dialogue is so crucial. How countries who did not benefit view what should happen next, what we're supposed to do with who has intellectual property, and how that is shared or not shared. I think that that's the reason for a summit like this, to actually have these conversations and try and move our mutual understanding forward. So I'm going to turn next to Thomas to reflect on the same question with regards to the accord from your perspective.
Happy to do so, and while agreeing with pretty much everything Minister Lauterbach said, I want to start with a bit of a contrarian approach. Given that we didn't have a pandemic accord, given that IHR were largely ignored by countries in terms of no travel bans, things like that, we did amazingly well. 326 days for development of not just one, but several effective vaccines, building, the ACT-A and COVAX partnerships while, on the air while the plane was already flying was quite remarkable. Therefore, for me, a key condition and concern about the negotiations, of which we are not part, we are, out of the rooms, we need to absolutely preserve what worked well, and even strengthen what worked well. And Professor Lauterbach said, the issue about innovation, it worked, but not only did it work, I've never seen this unprecedented number of partnerships, technology transfer across the board, academia joining forces with biotech, with big pharma joining forces with developing country vaccine manufacturers. I think we can do even more if we prepare already now these partnerships, but I'm absolutely convinced you cannot coerce that. We had yesterday a meeting where we had representatives from developing country, and I've had these discussions with generics as well as with vaccine manufacturers. All of them say it was possible because we knew each other, we trusted each other, we had partnerships, and we could bring our respective skill sets. Therefore, not only about IP, but also technology transfer, coerced will not work. But whoever looked at what happened in 21, after April, when Modi shut the border, you cannot say we do not need to invest in vaccine manufacturing capacity in Africa, but also in Latin America or parts of Southeast Asia. But that will take time. John Nkengasong, as head of the African CDC, said 60% by 2040. Now, 2040 is not tomorrow. And he is the first one to say it's aspirational. This is a long haul. That's why, for me, we really need to preserve the access to pathogens, fast, unhindered, preserve the innovation capability and the partnerships which worked well with the CEPIs, the Gavis, WHO, UNICEF, and we need to fix what didn't work well. There, I have to admit, it was a bit controversial internally. I was probably the first one in the industry who said the 6 months delay from Modi shutting the border to the real rollout of COVAX vaccines in Africa was far too long. And we can't just blame the vaccine nationalism. We too can play a role. That's why a year ago we came up with the Berlin Declaration. Companies signing up, we are willing to commit to putting aside part of real-time production of vaccines, treatments and tests for allocation by WHO or Gavi for those who need it most. This will only work if governments sign up to a social contract. I do believe, and that's part of the INB framework, we should sit down, how can we make this, in terms of trust, credibility, from a voluntary, non-binding commitments, which, by the way, has been signed up by developing country vaccine manufacturers too, into something which has teeth. That will only work if, for example, the United States signs up to it, sharing not after every American was citizen, but while the pandemic is going on. And I think we need also to join forces in talking about how can we do more on surveillance, healthcare system strengthening. But, engagement in diversity of manufacturing, continued engagement in voluntary technology transfer, and really make sure that this equity does work. Final word, my data, I'm a big believer in public perception data. Trust in science and even industry increased during COVID. We just did an Ipsos survey, which we will release in about 2 weeks' time. And what you notice, I'm deeply concerned about fake news, deeply concerned about social media influence. But overall, we shouldn't tell ourselves, nobody trusts scientists. Actually, trust in science and also the capability of the private sector increased.
Thank you. A lot of food for thought there. Let's go to you, Joy, next to reflect on the Accord and where we are.
Thank you so much. We believe that the pandemic treaty or Accord, what a commitment across all sectors. But we also need leadership from the private sector, from the social sectors. We need strength in action, and we need the action to be rapid. Reforms that are fit for purpose, that are sufficient to deliver desired outcomes, and that can adequately and sustainably be resourced. This is not easy. We know that WHO needs to be empowered with the responsibility, authority, and accountability to fulfill its leadership role. There's a technical lead in any pandemic, both in arresting the threat of a pandemic and in addressing it once it's in there. We need collective responsibility, all countries and all stakeholders working together. But we need to ensure equity in access and in outcomes, and ensure coherence with the ecosystem. All of us, not just between animal health and people's health, but between private and public sector, between the different sectors that are engaged. We need a robust monitoring and accountability system mechanism that is embedded in this treaty, that will ensure that it specifies legally binding obligations with compliance mechanisms incorporated, ensuring that countries and stakeholders can be held accountable for their obligations. And we would like to see this monitoring, including independent monitoring, to verify accountability with a focus on objective, evidence-based, multi-sectoral monitoring and specified responsibilities. I just want to emphasize here that I don't know if any of you saw Kate Callan's book, which she released at the beginning of this year, on disease X and the 100 days, that ideally we should take to respond when a potential pandemic hits. That is where we need to be. That is the gold standard. Now the question is, are we going to have the level of readiness which will get us there? I understand what you are saying, Minister, and what you are saying, that sharing of technology, intellectual property rights is going to be difficult, but we have to find a way. We cannot allow the length of time that it took for us to respond to COVID to be the length of time that is going to take for us to actually share the technology the next time around. We have to find a way. I know that it will be difficult, but some way has to be found. And I think you found part of the way by advanced market commitment and advancing funding to the manufacturers. Now the question is, if we can build a fund, pandemic fund, that is robust enough, that can actually fund that, do that advanced market commitment in order to enable rapid sharing of technology when the technology is developed, maybe that would be the solution. But I do believe that every challenge that faced us during COVID is posing us with a challenge to find a solution. And that solution must be found before the next pandemic hits. Thank you.
Christian.
Yeah. So about the motives in the accord, I can only speak from my professional perspective. And I remember in the spring of 2020, when we didn't know the age profile of mortality, we weren't sure about what's going to happen in Africa, right? So had we shared technology immediately, not much had changed this situation. So we did not anticipate that, in fact, strong social distancing and contact measures were somewhat, less necessary in many countries, for instance, in Africa, because of the age profile. And this could have been discovered early on if surveillance was in place in African countries. So if we had data from existing surveillance systems in African countries early on, we would have discovered that the disease burden may be much less for this one. And I'm saying for this one, because the next one may be completely different. The next virus is a different virus with a different age and disease profile. And again, there will be the same question marks unless you have a surveillance system in place. And so this needs to be in place. It can't be shared and it can't be financed by a pandemic fund because it's just too expensive. It requires national commitment in countries that have debt problems, big debt crisis, and budgetary issues. So they actually can't really afford the surveillance investment unless they see the use. So I think this is how the money should be used to incentivize and then, as you said, to hold accountable at the same time. But these things are not going to work without really solid national investments because it has to be in place. So that's probably one aspect. The other aspect, of course, is ownership. So it's nice and handy if technology is shared, but also there needs to be an ownership of technology. So this is probably applicable to all these sectors like vaccine manufacturing, where this is now on the agenda, but also diagnostics, the application of diagnostics, the existence of service diagnostics companies in countries. Then the treatment, the whole treatment issue, and then again the surveillance issue that's really at the heart of things. So without any surveillance system in place, how can we determine vaccine effectiveness in a population? How can we ever find out whether an investment in a technology pays back for the economy in this population, in this country? So surveillance is at the heart of things. This is where we are really at a loss in many, many countries and where the pandemic fund should invest, but it can only incentivize, so to invest somewhat too big a concept. It should be incentivation and holding accountable of the receiving end. And I agree to many other things that you, Thomas, and Joy said about these motives. Thank you.
I think my fellow panelists have said a lot already. Now, what is going to be predictable is the industry is going to respond to the market. It's going to respond to who pays early, who pays fast. Governments are going to respond to their populations as the primary goal, and some governments are going to go for to respond to their political interests on top of it. Now, at the end of it, I think it's important that this accord is not based on just goodwill alone. I agree with Thomas and a lot of other members here that the level of partnership that we have built over the last few years, over COVID, over the many years that we've invested in malaria, HIV, and TB, has built a good sense of goodwill among many different countries around the world. And these are the countries that we need to see investing in the accord and investing in the fund itself. But we cannot base it on goodwill alone. I agree with Joy's point that at the end there needs to be binding contractual obligations with an enforcement of what will happen if these agreements are breached, are not fulfilled. With intellectual property rights, you do have to have a counter on technology transfer agreements and making sure that regions around the world have the capabilities to invest in new products, but also have the capabilities already today in existing products, because patients need access to older drugs and the new technologies that are coming forward during the point of a pandemic itself. So we can do a lot now in building that, but we need to be more responsible with how IP is managed. We need to be more responsible with with agreeing to an accord by next year. I think the deadline is a real deadline, and be ready that there will be enforcements put in place if things are not put in place. Now, I think I want to remind everyone a couple of things just to close off. One is, at the end of it, when you think of one of the vaccines that we all took, I hope, for COVID, even though it's a single vaccine and we have the name of a particular company that produced it, it actually was created out of over 200 different components. They came from, I was last told from my data, about 19 different geographic locations worldwide. So when you have hoarding, when you have border closures, it means you're not going to be able to get your vaccine in time. And that's just for vaccines alone. So I do think that we all need to realize that we're all in a highly connected, interconnected world itself, but we cannot just base it on goodwill to prepare us for the future of the pandemic itself. The last fact I want to leave you with is 80% of the world's population live in low and middle income countries. So at the end, the accord needs to work for 80% of the world's population, ideally 100% of the world's population, not for a few countries around the world that are invested in the fund on its own. It needs to be a global public investment, and at the end of it, the public will need to understand whether they're going to be paying if they're going to be investing in a particular fund and investing in an accord. They cannot pay twice. They cannot pay to invest in a fund and later on bear the consequences of not getting access to essential commodities that they need during the time of a pandemic.
So thank you very much, distinguished panel. Let's get a round of applause for them. This is such a complex conversation to summarize, and I'm going to come back to each of you once before we close. But your point, Jaya, with regards to our interdependence and the fact that folks are here having this conversation because we cannot avoid not to have it, right? It doesn't matter where you sit in the world, how rich or resource constrained your environment is, we are all connected, and so we have to find a way forward. I want to make one point with regards to binding agreements versus an experience of commitment, because I think I represent a government where when we haven't signed binding agreements, we actually have made binding commitments that we've lived up to. So I just want to offer that, that has definitely been a lot of the experience of the United States in its support in the global health space. Minister, one of the things you said at the very beginning was about you didn't call it an oversubscribed space, but it is a very subscribed space, our global health space. And the diversity of experiences and just our ability to come together as a community to serve the citizens, I think has been a very positive thing for the global health community. What I'd like to ask you in your sort of final comments is there's an audience here of a ton of experts. There are folks listening to us online. Just what is that positive piece that you or your institution want to leave us with, so that we're not coming out of this conversation without a sense that there might not be a way forward, we're not going to get to agreement, because we have to. So I'm going to start with the Honourable Minister, and then I'm going to ask the rest of the panel to just come in after that with what are you going to leave us with? What is the positive thing you're going to leave us with as a result of this conversation? So Minister, let's start with you.
Well, first of all, I think we ultimately, and I'm an optimist here, we will be successful, and I agree with what you said, that indeed we were reasonably successful despite the fact that IHR was neglected by most countries. We were quick to find vaccines. Most of our, let's say, countermeasures worked, and despite the fact that 10 million people died, way more people could have died, and we were able to mount a global response. So in that sense, there is also part of the pandemic, if you look at it, it is a success story in many ways, despite the fact that we are still struggling with it. Ultimately, I think we will be even more successful if the new agreement is a fair agreement, if we come to a better understanding between what, let's say, is meant when we say we sit in the same boat. We lost, by the pandemic, we lost 10 times the GDP of Germany. I mean, this is just incredible, and this is by now, we are still losing money as we speak. So the pandemic had such an impact that it is a major burden for many countries that have messed up debts, and these debts somehow have to be paid. We could use the very same money now to invest, for example, in the protection of our climate. If we were to invest the money that the pandemic has cost us in preparation of climate change, for example, in renewable energies, in, let's say, solar energy devices, in research for coping with climate change, in artificial intelligence, for example, in order to, let's say, make artificial intelligence more quickly usable for tackling many of the problems we have. I mean, the amount of research and climate change investments that we could have paid for at the expense of the pandemic is just incredible. I mean, that would have been an investment that no one of us has ever seen in the past, and no one of us will ever see in the future. So a single pandemic was more costly than what we in total spent for climate change for many years. So that is my, let's say, take on this one. Each pandemic avoided is basically an opportunity for us to invest in what we have to invest in. There are so many issues we have to pay for anyway, and there are so many challenges ahead of us that we should try our best to avoid at least unnecessary challenges. Therefore, I agree that the pandemic agreement is a necessity, and we cannot, also from economic perspective and also a humanitarian perspective, and also from a moral philosophy perspective, if you look at, let's say, effective altruism, I think the pandemic agreement is the best instance of effective altruism you can all commonly think of.
Thank you. We're going to mix it up a bit. Joy, we'll go to you next. Your final thoughts.
Well, thank you so much. I think I agree with the Honorable Minister that sometimes things look so bad, you feel that, what can we do? Let's wait for this nebulous construct called government to do something and come and save us. The pandemic treaty, yes, we hope it will be able to encumber the government, to empower the government and stakeholders. But there is a lot that you can do as well as an individual. And I just wanted to focus partly on those things. Some of the amplifiers and drivers of COVID were social factors. They were technological in nature, which is really private sector. They were economic in nature, which is how we work, and how we choose to interact. They were environmental, they were political. Those are issues that we can do a lot on ourselves as individuals, as communities, as stakeholders, while we are working on the systems issues, including, the genomic surveillance that you talked about and the One Health. But pandemics are also about people and about communities. So how the cohesion of communities, how we want to work together, how we support one another. It is about the financing, we talked a bit about that, but it's also about governance. And governance is really a product of all of us, including the government. And my final take on this is that we cannot achieve all of this without effective monitoring and accountability. We have to make sure that we learn from our mistakes, and we can't learn from our mistakes and share best practices without monitoring, evaluating, assessing where we are, and doing analysis and addressing our mistakes and improving on what we have been doing. So my takeaway here is that there's an important road that we have to travel. We have to travel together. We can get there if we focus on learning from COVID-19. And I am sure that the next pandemic is coming. But I would like to hope that we will be prepared, better prepared for the next one than we were for COVID-19. Thank you.
Thank you, Joy. Christian.
Yeah, so I'm a university person, so I have to speak about education. So this type of ownership that we spoke about, many contributions here in the panel, it comes with education, of course. It comes with human resources. And when thinking about this complicated relationship in the multilateral situation, where a country is the receiving end and there is a multilateral organization providing funds, and there is questions of accountability and co-investment, education can be a solution there as well. A co-investment that you can ask a country for can be education. So even if the budgets are low, even if there are debts, even if there is nothing to invest, there will be universities in the country. And the involvement of university and the creation of human resources with a long-term perspective towards the topic can be a co-investment as well. So here, I believe education can provide an unexpected solution in a multilateral negotiation for investments and for accountability. This is a point that's really close to my heart as a university professor and as a person who has worked with and trained people in LMICs for long years. This is really where you see the benefit of investments. This is where you also see your work paying back, not only your money, but your time that you spend, that you see people grow up and stay in their countries and influence the situation and improve the situation there, and creating ownership in and for the countries.
Thank you, Christian. Jay.
So I mean, I'm fairly confident that by next year we will have as global health stakeholders, we've put some of our best negotiators to negotiate the accord itself to solve to make sure that we get there by May next year. So I think one of the key things that we can do is, whether we're from public sector, private sector, or independent, I think one of the main things we all have a voice in is being advocates for equitable access and preventing loss of lives in future pandemics itself. So, educating ourselves with understanding what have we done now that is going to save us for the next pandemic, and being that voice to talk about the examples of how has parts of the fund actually been dispersed. What is the impact of that going to be long term? And I think that will help grow the fund. It will also help ensure that more people are investing in the fund itself when they start seeing the successes. And I think that will be one of the key takeaways that I feel we can work together on for the next years.
Thank you.
You asked us to think about the positives, and I must say personally, going through the last 3.5 years with the pandemic, I take a lot of positive for me. One is we can learn from what worked in other countries, and my last intercontinental travel just early pandemic was Japan. Now, Japan and quite a number of Asian countries showed us the relevance of social distancing. Hugging, kissing, handshaking is not that common. Mask wearing is quite common, and it helped them to get through the pandemic better. And also it showed us the complacency on our side, whether it's in Germany, Switzerland, France, Italy, our healthcare systems were more fragile than we would have wished they were. That's not so bad. Second, I think we saw clearer than ever before the invest in health. It's about welfare, it's about the economic. And I've never seen as much engagement from the IMF, the International Monetary Fund, from Kristalina Georgieva to Gita Gobinath to Ruchi Agarwal, who taught us it's about economic security, not just about health. But last and foremost, I felt a deep team spirit when we sat on ACT-A or on COVAX. We developed friendships across the board with the colleagues from CEPI, from Gavi, UNICEF, WHO, because we're there for a common mission. I didn't know Richard Hatchett 4 years ago. Richard and I, we spent, I think, every Sunday morning for about 18 months having our morning prayer on what's happening on COVAX. I didn't know the developing country vaccine manufacturers. I developed friendship with the people from SII, Bharat, DCVMN, and I think this is a foundation for partnership which will serve us well in a future pandemic. We can build on these foundation stones. We just need to admit that all of us are much stronger if we join forces and join hands and build on what worked well, don't compromise, but really are willing to admit that we need two things in pandemics, which is not business as usual.
So would you join me in thanking this panel? I want to thank the organizers for having us here. I also want to send regrets from my boss, John Nkengasong, that he could not be here today. Thank you so much for your views, and I hope it helps us do better. Thank you, everyone.